Okay, so thank you for joining today's virtual discussion. My name is Dr. Bozena Theodoropoulos, also known as Dr. Buzz. I am the medical director of the Midwest Division of JourneyCare Hospice and Palliative Care. I have been with the organization for a little over 2 years, and I come from a background in family medicine, having worked in the Chicagoland area for over 20 years. And during that time, I took a special interest in the geriatric population and in those with complex medical conditions. And I think that experience really steered me into wanting to move on to hospice and palliative care. In my personal background, I have lived my entire life on the northwest side of the city and suburbs. And together with my spouse, we have 5 kids ranging from age 21 down to 5. And just to tell you a little bit about JourneyCare, it is a nonprofit, community-based organization that provides support to patients and families with serious illness. With 40 years of healthcare expertise and leadership, JourneyCare is licensed to provide care for adults and children across 13 counties in the Chicagoland area. And it is the largest provider of hospice and palliative care in Illinois. So now we will start with the meat of the discussion. Hopefully everybody was able to log in. And just so you know, I will be looking at some notes and looking at questions coming through, but there are no formal slides that will be presented on your screen. It will be more a discussion of advanced care planning with some time for questions also at the end. And I will be giving some examples of real life situations that will help underscore the importance of advanced care planning. So what is advanced care planning? Advanced care planning lets you decide how you want to be cared for if you are unable to speak for yourself. And advanced directive is the form that is used to document your advanced care wishes. So advanced directives are not necessarily used to provide less aggressive care or to take away options. This is a common misconception. They really allow you to make sure you receive the care you want under any circumstance, even when you may not be able to speak for yourself. So I think we can all agree that this is important to have these conversations with our patients, our families, and our loved ones. But how good are we at actually doing this? There is an organization called the Conversation Project, which is dedicated to helping people talk about their wishes for end-of-life care. And they regularly conduct surveys of the general population. And I would like to go over some of their survey results just to prove a few points. So when asked if talking about end-of-life care with their loved one is important, 91% of people say yes, but only 32% have actually done so. And why is that? Well, on the survey, 21% of people say that they haven't had that conversation because they don't want to upset their loved one. They don't want to talk about death and dying. But 95% of people say they are willing or want to talk about their end-of-life wishes. And 53% say that they would actually be relieved if their loved one started that conversation. Also, 80% of people say that if they were seriously ill, they would want to talk to their doctor about wishes for medical treatment towards the end of their life, but only 18% report having this conversation with their doctor. And one more example, 97% of people say it's important to put their wishes into writing, but only 37% have actually done so. So we see this disconnect here. When my husband and I were first married, one of the first things we planned to accomplish was to get our will done, our advanced directives done. But here we are 5 years later, and it took the threat of the COVID pandemic to actually get us to do this. I actually ran into a friend of mine today, and we were talking, and I told her that, I finally did this. It took 5 years. And she was sad to admit she's been married 27 years and they still haven't done this. So Maybe I gave her a little push there. So why have an advance directive? It's like having insurance. No one intends to use their auto or life insurance, but we have them for that just in case. The same reason we should have an advance directive. Especially now in the times of COVID-19, during this pandemic, we really have come to terms with the fragility of our loved ones. Not just our elderly family members and friends, but everyone. Everyone is at risk. Another statistic that supports having an advance directive, one survey estimated that 50% of people won't be able to participate in their own end-of-life decisions, that they won't have that mental capacity at that time. So things to consider when developing an advance directive. Advances in healthcare are keeping people alive much, much longer, but the quality of life isn't always considered. So we need to talk about what beliefs are important to you, be they spiritual, cultural, or religious. Also, are there any medical situations that scare you? Or have you had any personal experiences with the death of a loved one or a family member? And if so, how have these experiences impacted you? Our advance directives will really be based on our personal experiences, our values and beliefs. There is no right way or wrong way to complete an advance directive. So the advance directive options in Illinois, I will go over the three main forms used. One is the healthcare power of attorney form, and also the 5 wishes document. Now, anyone 18 years of age or older can and should have this in place. The next form I will talk about is the living will. This is a form that can be used if someone has a terminal illness. It's not used as much anymore since it is limited to someone with a terminal condition. And with this form, identifying a health agent is actually more helpful and preferred by healthcare workers. The third form is the POLST form. That's POLST form. It used to be called the old DNR form. That's the medical order that's created with the practitioner when someone is seriously ill. So in identifying a healthcare agent, you could use either document to identify your healthcare agent. The 5 wishes, which I have an example of here. Many of you have seen this booklet. Many of you are well familiar with it. And also the Illinois Healthcare Power of Attorney form. When I was first joined JourneyCare and I had my orientation and we were going over the 5 wishes, I was very glad to see that the 5 wishes document is available in multiple languages. When I tried to speak with my mother about her healthcare wishes towards the end of life, her primary language is Polish, and it's my secondary language. So sometimes talking about these detailed medical conversations, these really important conversations, it was hard to make sure we are understanding each other correctly. So being able to go over this 5 wishes form in Polish with her was very helpful. She really was able to read every section, able to write in her wishes, able to respond in the way she is most accustomed to. So both of these documents that I mentioned allow you to identify a health agent to speak on your behalf if you can't speak for yourself. The rest of the documents provide guidance for the health agent. And now 5 wishes also provide spiritual and emotional guidance. It is extremely important to pick the right person. So in selecting a health agent, this person must be 18 years old, and the person needs to be willing to carry out the wishes, even if he or she may not agree with them. So you need to talk to them in advance of selecting them. That is vitally important. And this person needs to be your advocate in a healthcare setting. They should not be one that would be intimidated by medical personnel. They should be strong enough to resist pressure from others who may not agree with your wishes. And it is important to note that only one person should be the health agent at a time. And then it's really important to have one or two or more successor agents. So I'd like to give you an example from my own family of the importance of picking out the right person. I had a family member who was diagnosed with multiple sclerosis back in his 20s. And as the disease progressed, he knew he had to make decisions about who his healthcare power of attorney would be. At the point where he was in his 40s and his disease was starting to progress, he was already divorced and he really didn't want his ex-wife to be his power of attorney for healthcare. He had 2 children, but he felt that they may be too young or emotionally immature to act on his behalf. So he chose his very close cousin to be his healthcare power of attorney. As he continued to decline in his health, he had episodes of recurrent aspiration pneumonia. And then the question of a feeding tube came up during one particular hospitalization for aspiration pneumonia and severe sepsis. When talking with his children, they wanted everything done. They wanted feeding tubes, everything to keep their dad around a little bit longer. His agent, his healthcare power of attorney agent, had long discussions with him, and he knew under no circumstances did he ever want to have a feeding tube. So he was the person who had to talk with the family, talk with the children, and try to get them to understand the reason for their dad's decision, the pros and cons of getting a feeding tube. In this patient's mind, the feeding tube was only going to prolong his suffering. So it was important that this health agent was one that could explain this to the family. And eventually they decided, yes, to do hospice care, avoid the feeding tube, and he was able to be kept comfortable in his final days of life. But it was difficult for his children, and if they were his power of attorney, at that time they were only 18 and 20 years old, it would have been difficult for them. Another example of the need to pick a right agent, this is an example from my family medicine practice years ago. This was a lady who was 80 years old. She had multiple medical conditions, including hypertension, diabetes, osteoarthritis, severe spinal stenosis, and she was really starting to decline in her health. She had 2 sons, one of whom was a lawyer, and he lived out of state. The other son lived with her and was her primary caregiver. But initially, she made her lawyer son her healthcare power of attorney, thinking he knew more about legal matters and all that. Since the son she lived with was the one who took her to all her appointments and had more discussions regarding her health, as her health declined, she really was able to realize that this son that lives with me and is my caregiver really should be the one who is my healthcare power of attorney. So she took her form, she changed it, she changed the order of successors, and was able to have her main caregiver son do all her important decision making for her when she wasn't able to. So when we do make these documents, it's important to talk about what does quality of life look like to you. So any additional guidance would be helpful for your health agent. And for example, when would it make sense to continue treatments or to prolong life or seek recovery? What is acceptable to you? And what would this look like? We need to think about if and when would the burdens of life outweigh any benefits. Also, it's important to talk about the location of care. If you want to remain independent, and what does that mean? Are you okay with living in an assisted living environment, for example? What is acceptable and what is unacceptable? And also the location of where you would want to spend your final days. Another statistic states that 75% of Americans say they want to die at home, but only 25% of Americans do. So now once this form is completed and you've chosen the healthcare power of attorney, it needs to be signed in front of a witness. One witness needs to sign this form. The form does not need to be notarized. And the copy of the form should be given to the health agent and each of the successor agents. Another copy of the form should definitely be given to your physician, And if you go to the hospital, a copy should be taken with you. Because if not, a new one may be made while you're at the hospital. The form should be shared with your family. This is vitally important. Shared with your family and your friends to ensure that your wishes are known. Do not put it in a security box. Also now, who could be the witness? The witness should be at least 18 years old. The witness can be a chaplain, it could be a social worker, a nurse, or any other employee of the healthcare facility. But the witness cannot be a family member, either by a blood relationship, marriage, or by adoption. It cannot be the practitioner or mental health provider like your PCP, and it cannot be the owner or operator of a health facility. So I just want to give another example of the importance of having these documents on hand. This is a story of a 60-year-old lady who was previously perfectly healthy, but she was recently diagnosed with ovarian cancer that was metastatic. Up until that point, she had been a full code, but recently had taken a really precipitous decline in her health. Her oldest brother stated that he was the power of attorney, but he did not have the documentation on hand. This was during a hospitalization where she was very ill. He was the oldest of multiple siblings, and he wanted to make his sister DNR and initiate hospice care, but the other siblings were unsure and they were not agreeable. Luckily, he was able to find his documents, bring him to the hospital. He was able to speak with his family members more about his sister's wishes, and she eventually did get admitted into hospice care prior to another steep decline where she possibly could have been intubated, and then the family members would have been left deciding on withdrawing care possibly. So with the help of the hospice team too, the family was more accepting and was able to talk more about the pros and cons of these patients' wishes. So it's really important also to tell your family your choices. Often I see the situation arise too, where a patient chooses his wife as his agent. Now, this patient may have adult children from a previous marriage, and they were not aware of this decision to make the wife the power of attorney. If he would just make his children aware of his choices and his wishes, this can give them time to get used to the idea and avoid conflict when a health crisis comes up. So I'm going to stop right now to see if there's any questions that are coming through. One question came up that says, my sister and I are very close, but we have very different philosophies on end-of-life care. She asked me to be her power of attorney, but I simply do not agree with her wishes. What do I do? And this is a difficult question. So many times we may not be on the same page with our family and friends and loved ones about what their wishes are for the end of life. So someone who is chosen to be the power of attorney should be willing and able to make the choices that patient would want. So let's say if you feel you really cannot make those choices in a time of crisis, to make the choices your sister would want, then you could either discuss it more or discuss it with multiple family members, or simply you may want to say that you don't feel comfortable being a power of attorney and she should choose another agent. It's always okay to say no to be a power of attorney if you feel you cannot carry out this person's wishes. Another question came through that states, my dad is very stubborn, and every time I bring up the topic of planning for the future, he gets very defensive and says, I'm not dying tomorrow, and walks into the other room. So any tips to ease this conversation? This is an all too common scenario. I think one way to approach it is to say, look, Dad, you have always been so proud of taking care of our family and taking care of the whole family. Give us the gift of being able to know your wishes so we can take care of you when the time comes. You could also paint the picture that it would ease the stress on the other family members at the time that he starts to decline and talk about end-of-life issues. Because the more we know about our loved ones' end-of-life wishes and plans, the less stress it is for everyone. Another question came up saying, I was divorced last year and my wife was my power of attorney. What do I do now? That you could always keep your ex as your power of attorney if you feel that's the best choice. But of course, you could change this at any time. You could choose anyone to be your healthcare power of attorney if they fill those criteria of being 18 or over and being able to act on your behalf. I'm going to go on to the rest of the presentation and we'll go through some more questions later. And before going on to discuss the living will and the post form, I would like to talk a little bit about what happens if a patient lacks decisional capacity and there is no healthcare power of attorney. Who makes the decisions then? So this goes into the Healthcare Surrogate Act of Illinois. It is for cases where a person is unable to make his or her own healthcare decisions and does not have a healthcare power of attorney that authorizes others to make these decisions. In such cases, the Act allows family members, friends, or guardians to make medical decisions, including decisions whether to forego or not use or end life support. Now, two physicians need to sign that the patient lacks decisional capacity, and there is an order of priority used to determine who will serve as surrogate. So it starts with the patient's spouse, then adult children, and it goes down the line of family and then friends. The next document I want to talk about is the living will. This is the first advanced directive developed. It allows the patient to state whether or not she would like death-delaying measures used at end of life. It really only applies when the patient has a terminal condition and cannot speak for himself or herself. A health agent is not required on this form, and this form requires 2 witnesses. If a person has other advanced directives, like the healthcare power of attorney and a post, this document really isn't that necessary, but it's good to have. Now I want to talk a little bit about the post form. I have one here. You guys all know what that one looks like, right? This one is not in that neon yellow or pink, which is good to have in those colors so everyone can see it. The post stands for Practitioner Order for Life-Sustaining Treatment. Now, why would you have a post? A post form helps to ensure that a person's wishes at end of life are followed. It is a medical order, so emergency medical personnel are required to follow its instructions. Without a post form, the emergency medical personnel are required to give all possible treatments, whether a person wants them or not. So let's say someone collapses at home. Their post is not readily available or seen on the best place for it on the refrigerator. If medical personnel don't see this form, they are required to do everything to resuscitate that patient. So who should have a post form? A post form is appropriate really for any person who is seriously ill or frail. A post form is not for everyone. A young, healthy person does not need a post form. It is a voluntary form and it cannot be required. A post form goes into effect during an emergency when you cannot make your own decisions. So what should I know about this post form? It should really be completed with a healthcare practitioner after an in-depth discussion. This conversation is really important. It should address your overall health, your health wishes, and your goals of care. And the post form should always travel with you to different healthcare settings. So at home, assisted living, the hospital. Because like I said, if you go to the hospital, a new post may be completed when you're there that may be not in line completely with your old and original post. Of course, you could change your wishes or void the post at any time. So the POLST document, it is a medical order with 3 sections that allow a practitioner to document your wishes. That first section A is the resuscitation wishes. That is CPR or no CPR. This section applies only when someone has no pulse and no respiration. So this patient has died. It is the only required section on the form. The others are optional. So the question you want to ask yourself or your family or loved one, if you die a natural death, would you want CPR? So that is the yes CPR or no CPR. Then the next section, section B, applies to someone who is not in cardiopulmonary arrest. They still have a pulse or they are still breathing. So the options on this section are 1, full treatment. This means get as much treatment as possible. This may include going to the ICU, being supported on a ventilator, the whole 9 yards. The second section is selective treatment. This usually means going to the hospital, getting certain treatment measures, but able to choose the extent of treatment. So you could choose, yes, I want IV fluids, I want IV antibiotics, I want oxygen, but you may say, I don't want BiPAP. And this section also is do not ventilate. People who check this section off do not want to be on a ventilator. The last section is comfort focused measures, the last option rather. This option is more the treatment you want is to relieve pain and suffering with medications or oxygen. The location of this care is usually then at home. People don't want to go back to the hospital. And going to the hospital may be only if these measures are not able to be attained at home. So like I said, the pulse can be changed at any time. And I want to give another example from my family. We had an elderly aunt in my family who was 85 years old. She was fairly healthy with hypertension, but she had atrial fibrillation, spinal stenosis. And she had chosen, after careful consideration, to be do not resuscitate and selective treatment on the pulse. She did not want to be on a ventilator. And she was in fairly good health when she came down suddenly with a fever and shortness of breath. And she was diagnosed with bacterial pneumonia. And as she was decompensating, we were having the discussion with her, and she decided that, you know, I want to be on a ventilator, because if this is pneumonia, I may be able to recover from it. So she was intubated. She was on a ventilator for 3 days, but was successfully extubated and was able to recover from pneumonia. That is also important to know in that post form, when you choose full treatment, let's say you choose I want to be ventilated, there's a section for additional orders. You could say I want to be ventilated for up to 7 days, 2 weeks. You could write in your wishes. If you feel there's no chance to get off the ventilator, then after 7 days, I'm okay with withdrawing care. So there are options on the post form to state what your wishes would be, even when you select the full treatment. So it's important to know with a post form, in addition to the post form, you should have that advance directive identified in your health agent, because the post form goes through certain scenarios, but the health agent might still need to provide guidance on items that are not covered in the post. Okay, so at this time, I'll go through a couple more questions. So can the 5 wishes form be printed off the internet? Yes, I think these forms, there's also a link on our JourneyCare site that you'll get in the email with a link to all of these resources, be it 5 wishes, healthcare power of attorney, that will all be available to you with a link through that email. But it can be printed off and you could take it, fill it out, look it over, read through it carefully. It's important to not make these decisions quickly, to really think about all these questions. Another question came through saying that I'm a single mom and my son is 22. Is he too young? Or is that too much pressure to assign him as my power of attorney? And that's a really good question. It all depends on the person, right? Depends on his level of maturity. I would recommend sitting down with him and other family members to discuss your wishes at the end of life and see how he responds. See if he thinks, yes, Mom, I think I'll be able to be your voice for you at this time. But everyone at 22 is different. There are people who are a lot more mature than others, and some kids at 22 may not want to make that decision. So it's important to talk to him about that and see if even he's willing and able to be the agent. Another question came up saying, can my doctor help me to complete my 5 wishes document? Definitely. I recommend making an appointment with your PCP or the main specialist that takes care of your serious illness, or to sit with your primary care provider or other physician and make an appointment just to talk about the advanced care planning. I know during annual wellness visits for Medicare, that is a required portion of the visit, is to talk about, do you have advanced directives? But in the time allotted to a visit, we know that visit times are pretty short. So I think it's a great idea to make a decision, to make an appointment just for that reason only, to discuss advanced directives. Another question came through saying, my grandma has dementia and we never discuss these issues with her. How do we know the choices we're making for her are what she truly desired? Right, and it's hard when she's not able to make these decisions at this time. But again, I would have the conversation with the family and talk about, even maybe over a holiday or a family gathering, anytime that you could talk to the other family members about, what do you remember Grandma talking about in the past? What did she ever say to you about, would she want this? Would she want to be in a nursing home ever? So it's important to talk to other family members to kind of get a sense of what they feel were her wishes when she was still able to make these decisions. So I'm going to go ahead and talk about a little bit more into my talk about discussing this advanced care planning before a crisis. This is critical. And it's critical to do these conversations when a person is still able to make decisions. And so these conversations, like I was saying, should be with the person, their physician, their family members. Like I said, making that appointment with your physician simply to discuss your advanced care wishes. So it is important for each of us to think about our advanced care wishes in advance, because making decisions in a crisis is difficult. And if we document our wishes, our family can feel confident that our wishes are being followed. If your loved one doesn't know your decisions, how would the stress of making these decisions impact them? And if we don't really think about and know what we want, how can we ask others to make those decisions for us? I've been also asked, how often should I review my advanced directives? It's important to review these from time to time. Some people recommend every 10 years, if not more often. You might want to revise your preferences for care if your situation or your health changes, or you might want to make adjustments if you receive a serious diagnosis, or if you get married, if you get separated or divorced, if your spouse dies, or if something happens to your agent or alternate. It's important to choose another or other alternates. If your preference change, you will want to make sure your doctor and your agent and your family know about them. I'd like to give another example of a clinical scenario. We recently had an 89-year-old gentleman with end-stage COPD, very serious lung disease. He had no advanced directives at all. He became lethargic at home. His wife called 911 and he was taken to the hospital and he required intubation. And then he was found to be in renal failure as well. His wife was unaware of how severe his pulmonary condition was. She didn't realize his lungs were that bad. She felt that he was a fighter and she wanted everything done. He started on hemodialysis and he was on the vent for multiple days. They were unable to wean his vent. The wife then opted for a tracheostomy and PEG, a feeding tube placement. He never regained consciousness, and she eventually made him a DNR, and he ended up dying on a ventilator. So this example really speaks to the stress that falls upon a family member when making these decisions during a crisis. If this patient, let's say, and his wife would have had these conversations earlier on, her stress would have been much lessened. Another study I saw showed that rates of depression in those who have lost a loved one or are significantly lower when advanced directives were in place and these conversations had already taken place. That stress on the rest of the family members is really lifted. So I want to give another clinical example. I think we learn a lot by just going through examples of different scenarios. So there's a 70-year-old male with a history of hypertension. He was a light smoker, but fairly healthy. He went to the hospital with abdominal pain. He was found to have colitis and he was placed on IV antibiotics. Now this gentleman was unmarried. He had no children. He had no advanced directives whatsoever. He had one brother, but his brother was quite ill himself. So unexpectedly, this patient became unresponsive in the hospital. He had no pulse. CPR was administered for over 20 minutes. He was intubated. He was on pressure medications to maintain his blood pressure. His one brother, who was extremely ill himself, was contacted and he stated he was just unable to make these decisions. He was not willing to act as the surrogate. So he referred the healthcare workers at the hospital to a family friend. So now this family friend was the one ended up needing to make these decisions. The patient had an EEG done to look for brain activity. It showed no meaningful activities. And now she had to make the difficult decision of withdrawing care. And she hadn't had any conversations with this gentleman prior about his healthcare wishes. So imagine the stress that was placed on her getting this call out of the blue. I want to go through one more clinical example to, in terms of stressing the importance of really making your end of life wishes known. There was a young man about 50 years old. I say he's young because that's my age. And he unfortunately was diagnosed with a progressive cancer. Now, this gentleman was raised in the Hindu faith, but his wife and his children were Christian. And over the years, he had started going to Christian services with his family, and he actually wanted to have a Christian burial. He never spoke of this to his parents, who were both alive, because he was thinking he would most likely outlive his parents. But now with this diagnosis of a very advanced cancer, he would be dying with both his parents not knowing that what his wishes were at the time of his death. So luckily, with chaplain support through JourneyCare Hospice, the chaplain was able to initiate the conversation with the entire family, the parents and the wife and the children, and talk about this patient's end-of-life wishes. So I want to go through one more question here we have. Has the topic of advanced care planning come up a lot during this time of COVID with your colleagues, social workers, and nurses? How do you think we can bring more awareness to this important topic? Oh, indeed. Like I was saying, it really took COVID for myself and my husband to say, oh my gosh, we don't have our advanced directives. And it's funny, we went to our trust lawyer, will lawyer, and they were extremely busy about a month ago with the influx of people trying to get their wills done, their trust done, their advanced directives done. So I think there's a lot of need for awareness. I think each one of us being a voice to our patients, our family members, our loved ones, ourselves, and being that kind of advocate for others. You know, I think too, taking the 5 wishes and giving it out at the next family meeting, family party, when we could all be together again, or even with 6 feet of distancing, you could hand out that 5 wishes and just spread the word about it to really make known how important this is. There is another movement a day called the National Healthcare Decision Day. This day is April 16th, and it was founded back in 2008 by a healthcare lawyer. And the goal of the National Healthcare Decision Day is to demystify the healthcare decision making and make the topic of advanced care planning inescapable. So among other things, the National Healthcare Decision Day helps people understand that advanced healthcare decision making includes much more than living wills. It is a process that really should focus on conversation and choosing an agent. So that it may be a good time to get the copies of these, give them out to your family members, spread the word as much as possible, share the links that you are receiving to these documents, share the links with your family and friends. I think that is really, really important. Another question that came up was, does JourneyCare provide education to hospitals and nursing homes on 5 wishes and advanced care planning? Yes, indeed. We have a team that goes out and does a lot of community outreach with trying to get the word out about the education that's needed to provide this information to others. So I think it's kind of funny that National Healthcare Decision Day was chosen to be April 16th, since, of course, it's the day after tax day. So we know the 2 things we can avoid: taxes and death. So I think we'll probably be ending a little bit early. Luckily, you get a little bit time back in your day. But I would like to thank you, really thank you for attending today's discussion. I hope you found the information helpful and that you're all a little better prepared to provide your residents, your patients, and your family members with this important information. Please note that soon after today's event, we will be sending out an email to all those who have registered. It will contain the link to the resources that we've been talking about, as well as information on how you may obtain your 1 hour of continuing education credit. All right, and one more question came through. Does a POLST need to be signed by a physician? Yes, a physician or an advanced care, advanced practical nurse, so an APN. All right, and with that, I want to see if there's any final questions before I go. Going once, going twice, type quickly. All right, I don't think there are any other questions at this time. So with that, I'd like to thank you and take care, stay safe.